Hi, everyone. Thanks for joining Doug and I. It's getting to the end of the year 2022, and we are getting pretty excited because it's 2 weeks to go to the start of the year's biggest event, the most impactful conference we've ever done. I feel like it's really coming together. Everybody's really excited about the speakers who are coming to present, about the big focus on diagnosing addiction. How do you support the person who fits into the criteria of being diagnosed with addiction? What are the treatment options and treatment protocols that are best going to serve? As we talk about those, you can we'll figure out how to individualize programs for patients, for the healthcare professionals who are attending. The Symposium for Metabolic Health is open to the public, so anybody who has an interest in individual health, health from a sports standpoint, health from a medical professional standpoint, community health. We were just talking a little bit earlier. Are we talking about addressing diabetes? Are we talking about addressing other chronic illnesses? Are we talking about addressing mental health? Are we talking about neurological health? All of these topics are going to be covered throughout the weekend. How does and what type of exercise contributes to metabolic health? So Dr. Ben Bakikio will be talking about that. Mark Cucuzella, who's an incredible long distance runner, who's in the military, who's also a practicing physician, who can talk about all areas of metabolic health. We'll also be talking about endurance sports, performance, athletic performance, and I'm sure he'll cover diabetes and weight loss and obesity. We're going to really get into the history of nutritional recommendations, the history of what man has been eating with Dr. Mike Eads, the history of nutrition recommendations with Nina Teicholz. Should we limit saturated fat? Should we limit meat? Why have we been told this over the years, and where did we get it wrong? Ben Bickman, who's an incredible biochemist, is coming down from Utah. We're so fortunate to be able to have him in attendance and learn from his brilliance. There's always learn from him. Talking about insulin resistance and the root cause of illness. How does insulin resistance influence more chronic illness? If we started looking and testing for insulin resistance earlier, how could we manage and prevent the development of prediabetes, diabetes, obesity, and a whole host of chronic illnesses, PCOS, fatty liver disease, cardiovascular disease? If we started looking at some things earlier, could we actually prevent the development of these? Because we have an epidemic of diabetes, we have an epidemic of heart disease. We've been talking about cardiovascular disease and low fat for 60 years now, but since the 1950s, 70 years. Where is it getting us? Well, we're going to talk about processed food addiction with Joan Iflin. We're going to talk about sugar addiction with Nicole Avena. We're going to talk about all kinds of different aspects of food addiction and how the brain works with Vera Tarman and James Greenblatt and Jen Unwin. We're going to talk about neurological diseases and health with Michael Hoffman. So there's some new people coming into the conference that we're going to get introduced to. It's going to be great to learn from them. Dom D'Agostino is going to share his brilliance with us again this upcoming weekend. He has so many areas that he can talk about with brain health and metabolics and biochemistry. There's a schedule on the events page, which is at lowcarbusa.org. Halfway down, there's a schedule. Dr. Tro and Rob Sivas are both going to be speaking on the addiction component, and they can talk about any areas of clinical application for any of the above that I just mentioned. Dom's topic, metabolic-based neuroprotective strategies. And then I'll go into Michael Hoffman's brain failure and the low carbohydrate diet imperative. I actually really like that brain failure. That is something that we haven't called Alzheimer's yet, and dementia, brain failure. Eric Westman, who's been working in the space of carbohydrate restriction, reduction, he calls it keto medicine, the evidence-based summary of 20 years he's been working in this field. He's going to share his expertise of keto medicine. He's just had such success. He's written more than 20 research papers, been authors of numerous books. He's going to come and share his expertise with us. Annette Bosworth, I just got done reading her incredible book about her journey to help her mom battle cancer, leukemia, and learning the hard way about fasting and the ketogenic metabolic therapies for cancer. That can help people through their treatments to be able to limit the kind of side effects that chemotherapy and radiation gives, and also make it more effective. And also her mom had to get to a certain point where her blood levels were okay, that she could actually have chemotherapy again, and be able to have chemotherapy. But she's been helping patients now for a number of years. Once she learned this and realized how many people she could help, she wrote a book. She's got a YouTube channel and a practice where she's helping many, many people. She's going to share her expertise with us. She's realized what the title of her talk is, Average Blood Sugar Matters Most. Are you looking at the A1C? But she'll also talk about, I'm sure, insulin. The panel discussions are a really big highlight of the weekend. And we're going to do a little bit of a new format. Doug has planned with Tro on the Addiction Day on Friday, since we had so many speakers, to do 3 shorter presentations with a panel discussion between the 3 presenters. And so there'll be a morning session and 2 afternoon sessions where there'll be 3 speakers, shorter presentations, and then a longer panel discussion between the 3 of them. And if there happens to be time for questions from the audience, we'll see. Preet Pata talking about the contribution of insulin resistance and inflammation on chronic pain and mental health. So he's really great at explaining what he's been doing in St. Louis and his practice to help people reduce chronic pain and chronic illness, even in, we were talking about, in ethnic communities that don't have access to really good health care, lowering the healthcare costs in his area, in his clinic, to be able to help more people. And Mike Eves on Saturday is going to have our first poster presentation at our Florida event. We had poster presentations in San Diego this past year, where people could come in and talk about their work, talk about their programs, talk about the books that they've written on metabolic health applications and the benefits. So that we've got about 20 planned for the Saturday evening, and those posters will be up all weekend for everybody to explore and meet the presenters. And Sunday is going to be a fantastic day as well. Friday and Saturday night, there's a chef-prepared buffet dinner that's included in everybody's registration, where we sit down, we decompress, we share stories, and enjoy what you know to be, because we've worked with the chef over many years and told him why we don't want sugars, why we don't want grains, why we want really good natural fats and not processed vegetable oils in any of the dishes. And that actually includes naturally made low sugar, no sugar wines that will be at the wine tasting, the networking event in between the sessions and dinner, and then it'll also be served at dinner. So anything I forgot about the event, Doug?
No, I think you covered it all.
Everybody can watch from the comfort of their home and office, the live stream, or you can sign up for last-minute in-person tickets. There's still room, or the hotels sold out, but there are a list of hotels that are very close by that you can stay at. People are still signing up last minute. You can also. All of the information is on the website, on the event page for the Symposium Metabolic Health Boca Raton. It's going to be the weekend of January 13th to the 15th. And if you can get in on that Thursday early, there's a bonus workshop that 50, 60 people have already signed up for. But if you're attending in person or watching the live stream, you can watch all of the replay videos are available to you. So if you don't happen to have your schedule free to watch from home or from your office that whole weekend, you'll have the replays to watch, just so you know. Now it's really important to people. They either want to view it in their, when it's time it's more convenient, or review it again, because there's so much information. We really appreciate you considering joining us, so you can learn and share the opportunity with others, because every time we're in the conference, we always think more people need to hear. I'll be in the back of the room listening to a presentation and say, everybody needs to hear this. We wish there were more people that could hear this information to help improve their health and the health of their loved ones. So we look forward to y'all joining us. Thank you.